Okay, so basically we're talking about rural cancer centers in Arkansas, and one of the things about Arkansas being a rural state, it doesn't lack for the ability for cancer patients to get treatment. A lot of communities, even of small size, have cancer treatment centers. The most common ways that we treat cancer today are surgery, chemotherapy, and radiation therapy. And most of these facilities do have all of those tools in their arsenal. A couple of the things that we use today, some of the facility that we use that are very standard in the state of Arkansas when cancer patients get diagnosed. Cancer, basically, we talk about the types of cancer people see, and although these cancer centers these rural cancer centers see all types of cancers from blood disorders to brain tumors. The most common cancers that typically are seen are prostate, which is a cancer for men, breast cancer, and we see typically that in women, but although breast cancer can't be ruled out in men, and then lung cancer, which we typically like to attribute to smoking. Those are the three largest types of cancers that are mainly treated in these facilities. Skin cancer is one of the most diagnosed cancers in the United States of America, and we attribute a lot of that again to sun exposure. You ready?
Yeah.
So a lot of the things that we do is important in Arkansas is that patients get diagnosed properly, so that we're using the proper equipment to do all that. So we're using PET scans, CAT scans, blood work, surgical procedures, but we want patients to get diagnosed properly. So visiting their doctor is important. The use of high technology is very valuable and essential in not only getting diagnosed early, but also getting treatment early, and eventually and hopefully getting a very good prognosis. If we catch it early, we typically can treat it, and survival is way higher. Last couple of years, what we've seen is a huge survival in cancer. Up until about 4 or 5 years ago, more people died from cancer than survived with cancer. And now we're starting to see overall survivals exceed the death rate. So people are actually surviving their diagnosis, and people are actually surviving cancer. So cancer certainly is not the death sentence that we once saw. So I've already discussed radiation is one of our main tools, our main instruments in treating cancer. A patient comes in and we already know radiation causes cancer, but precisely aimed radiation can also be used to treat cancer. It can cut like a surgical knife, or it can kill cancer cells as they start to grow. Typically what we describe cancer as are cells that are growing out of control, and the body has no good way of keeping them from growing out of control. And so what we do is we damage those cells, the cancer cells, with radiation, and then the body absorbs those cells as they die off. So radiation is available in a lot of rural communities in Arkansas, and it is a very valuable tool in how we treat today. One thing that is a concern to most patients is cost, and the cost of the equipment that's now needed to treat cancer is very, very expensive, and so treatment itself has become very, very expensive. So radiation therapy treatments do come at a very, very high cost. Luckily, almost every insurance company in America sees radiation as a normal part of cancer care, and so it's typically covered under every cancer policy or insurance policy. As far as discuss radiation, the other big tool we have in our arsenal is chemotherapy. And every day, typically Monday through Friday, and even on the weekends, a lot of times, each one of these recliners are full of patients undergoing chemotherapy, which is chemicals introduced into the bloodstream that targets cancer cells. Probably the biggest advancements that we've seen in cancer care have been from the chemotherapy side. There are so many new drugs being introduced into the market that allow cancer patients to have very specific or personalized treatment options. And we now know that there are some cancers that don't respond well to some types of chemo. So now we're able to identify those before their first chemotherapy treatment, give them the right medicine that's needed, and to give them the best chance at survival.